Happy Families podcast. It's the podcast for the time-poor parent who just wants answers now.
Hello, this is Dr. Justin Coulson. I'm the author of 6 books about raising happy families, the founder of happyfamilies.com.au, and I just can't get enough of saying this, the host of the brand new Channel 9 television show, Parental Guidance, which comes out really soon. Here with Kylie. What are you laughing at?
You're just so funny.
I'm so excited. I can't help it.
You deserve to be.
Well, thank you. Kylie, mum to our 6 kids. And Kylie, today we're having a conversation that is, I think, a really, really important conversation.
I think it's an important one. Yeah, definitely.
So we're talking with Dr. Jessica Kaufman. Jess is a research fellow in the Vaccine Uptake and Acceptance Group at the Murdoch Children's Research Institute. She's also an honorary fellow of La Trobe University and the University of Melbourne, and she researches vaccine-related communication and social science. Basically, what's going on with vaccines, how are people responding to them, and what's the messaging around it, and what does that mean for people? It's such a big deal because on the weekend, the long weekend in Queensland, I said to our 3 kids who are now over the age of 12, hey, what do you think about going to one of the walk-in centres and getting vaccinated? And I got a range of responses from our children, and all 3 of them who were eligible said finally, okay. There were tears. It didn't go particularly well, especially for one of them. And there was obviously 48 hours worth of sore arms, the COVID arm thing. Everyone... That needle kind of sort of stings for a couple of days, but we got it done. But Kylie, you and I have had enough conversations recently with people to know that there is a lot of hesitancy, I think would be the right word.
Yeah, definitely. And it's a conversation that is happening at every dinner table and, you know, every phone call with friends and family. This is a big deal and people are really trying to work out how this works for them.
So we've got Jess on the line, Dr. Jessica Kaufman, like I said, from the Murdoch Children's Research Institute, from the MCRI, to answer some hard questions for parents who are hesitant, who are concerned, or who just don't know where to go with this. Jess, thanks so much for joining us.
Thanks for having me.
I was doing a little bit of research around this and found a paper that was published just recently in the official journal of the American Academy of Pediatrics. Peter Szilagyi and his colleagues have published this paper looking at how American parents feel about their kids getting vaccinated. Now, I know we're not America, but I'm wondering how similar we are. What it basically found was that around about 46% of American parents are saying that they are either very likely or somewhat likely to have their kids vaccinated against COVID-19. But 41% of them are saying, I'm either somewhat unlikely or very unlikely to get them vaccinated against COVID-19. I don't trust it. I don't know enough about it. What do we know about Australian parents and their likelihood of vaccinating the kids against COVID-19?
Well, we're actually working on a study right now as we speak from the Royal Children's Hospital poll. They do a child health poll regularly. So we do have some data that we're putting together at the moment. So I have to be a little bit cagey about exactly how much I can share about that. But generally speaking, I can say the parents who vaccinate themselves and who are willing to vaccinate themselves are obviously more likely to also be willing to vaccinate their children. But we do see a slightly lower percentage of parents. So some people who are vaccinating themselves are a little bit uncertain or a little bit hesitant about vaccinating the kids. But I would say that the proportions are a little bit different here versus in America because we have, broadly speaking, a higher vaccine accepting population of adults, I think, than in America. So that kind of has a knock-on effect.
Yeah, so in other words, Aussies are pretty cool with getting vaccinated themselves. We've got a really high uptake and therefore we're more likely to get the kids done. Now I want to be a little bit provocative here and I think, so I would actually rather my kids not get vaccinated. But because the government is essentially mandating if you want to leave the house in a couple of months' time.
Let's just clarify that though.
They're not mandating it for kids, just to be very clear.
Sure.
They're not.
You're saying that you would prefer not to vaccinate our kids against COVID.
Yeah, sorry. Thank you for clarifying. I'm talking specifically, when we mention vaccinations in this podcast, we're talking about COVID-19 vaccinations. So because of the increasing restrictions and government expectations around who's vaccinated and what they can do, I was kind of like, I don't really want to get the kids vaccinated. I don't think that it's that important for kids because when you look at a recent study that came out of Stanford, what they found was survival rates in unvaccinated children aged 0 to 19 years, 99.9973 of kids survive even if they get COVID. 99.9973. In other words, I'm terrible at maths, but It's a really, really, really low percentage of children who really suffer because of COVID if they're under the age of 19. And so I was kind of looking and going, well, we're going to do it because the government's making it really uncomfortable to not be vaccinated. But is there a strong argument to vaccinate kids when the survival rate is that high?
Well, first of all, I don't think the survival rate is the only thing that we should be thinking about here. Just on the survival rate alone, though, you're talking about sort of over 1,000 kids dying of COVID. So even with that, when you blow up those really, really small percentages onto a population level, you are still talking about, pretty, severe outcomes for a large number of kids, which we could potentially be preventing by vaccinating. But the other thing I think that is not necessarily clear through just looking at how many kids die is all the other knock-on effects. How many kids are getting long COVID? We know that it's maybe 1% to 2% of kids who maybe go on to develop some long COVID symptoms. That said, we are still trying to study that. So it could be, more people, we're not necessarily sure. And then all of the things like being sick and missing school and, missing their friends and things like that.
They've missed a bit of school already. Yeah.
I know, of course they've missed a lot already. But, I think that we think about the vaccine as maybe it's not as critical for preventing large scale death or severe illness in kids, but it does still have a benefit. And I would be encouraging people to consider it just as a additional safety measure. We don't see severe side effects from the vaccine, and we do see potentially severe side effects from COVID.
So, Jess, I'm really curious about the side effects. We're talking about, safety measures for our children, but there are definitely some side effects short term, apart from a
sore arm.
A sore arm. I woke up the day after and I thought my arm had gone dead. It was so sore, and I kind of bashed it before I realised that it was actually the needle site.
And the kids were complaining after their needle. They're like, oh, my arm's sore for like 48 hours.
So what are the short-term effects that our children will experience possibly?
Well, so the most of the short-term effects are similar to what adults are experiencing. Like you said, the sore arm, a headache, getting tired. There is a side effect that parents probably want to be aware of, which is myocarditis or pericarditis. So that's swelling of the heart or of the lining around the heart. It sounds really scary, but the good news is it's rare and it's also generally relatively mild. Some people go into hospital just for a little bit of monitoring, but they recover well and go home. And it is a little bit more common in young men. So you might hear a little bit more about that for sort of teenage boys, that kind of thing. But again, rare and generally pretty mild.
So with that side effect, Jess, children with, heart defects or anything, does that play a part in their eligibility?
So most cardiac conditions are not considered a contraindication. They don't mean that you are not able to get the vaccine. If you've got a cardiac specialist already, it's a good idea to just have a conversation with them or with your GP before you go ahead. But for most kids who have had any sort of cardiac issues, they can still be vaccinated.
So in my conversations with my friends and, other mums, the biggest concern that we have is the long-term effects. The COVID vaccine hasn't been around long enough for us to know whether or not there actually will be
all the other vaccines that the kids have had previously have been around for decades.
Yeah. So,
well, I think that's a really reasonable concern. And I hear that all the time. And lots of people have thought that and been concerned about that as adults, and certainly thinking about our kids. But I guess it's sort of reassuring to know, first of all, that of all the vaccines that we already have, none of them really generate any sort of side effects after 6 weeks after vaccination. So any longer than 6 weeks after vaccination. So there's not really any reason to believe that there would be any side effect that appears suddenly much longer after children have been vaccinated with the COVID vaccine. And also, we've already given the COVID vaccine to sort of tens of millions of kids in other countries. So our country has the benefit, I guess, of looking at the experience of the rollout in other countries. And there have been no serious side effects or anything like that comes up even sort of, a few months after vaccination.
We're talking with Dr. Jess Kaufman from the Murdoch Children's Research Institute about vaccinating children against COVID-19. More questions about the rollout, about which brand we should be making sure that our kids get, and about what to do about needle phobia right after the break.
It's the Happy Families Podcast.
Imagine a home where discipline got results without anyone having to feel bad or in trouble. The Do's and Don'ts of Discipline is a webinar to help parents set limits with love, compassion and humanity. Find it now at happyfamilies.com.au/shop.
It's the Happy Families Podcast, the podcast for the time-poor parent who just wants answers now. And today we are talking with Dr Jessica Kaufman from the Murdoch
Children's
Research Institute.
All those acronyms, so many letters. Jess, we wanted to know, what can you tell us about the vaccine rollout for kids here in Australia?
So the vaccine is available for all children aged 12 and up in Australia right now.
So if they've turned 12, they're eligible and they can go and get it. Jess, what about for younger kids? I know that in various parts of the world, children under 12 are now experimenting with or being given the vaccine. What can you tell us about that rollout?
I don't know of anywhere that's actually delivering the vaccine to children under 12 as part of their national program, but there are trials underway. And there's one in particular in America with the Pfizer vaccine, which is nearing completion. So they've submitted data to the FDA, and they're looking for approval to deliver that vaccine to children 5 to 11, and they're still collecting data on delivering it to children 6 months to 5 years, and that's sort of expected in the beginning or first few months of next year.
Wow, that's amazing. Is the rollout going well here in Australia? Do you have data on that? Are the kids lining up for it, or is there the teenagers are dragging the chain?
No, so far the rollout has been going really well in kids 12 to 15. Of course, 16 and up has been eligible for a while, but no, there's been really high uptake and a lot of people lining up to get those vaccines.
So, Jess, does it matter which brand they receive?
No, it absolutely does not matter which brand kids receive. They are able to get the Pfizer or the Moderna vaccines, and both of them are excellent and very effective and safe in kids.
Lots of kids are really scared of needles. We have one who literally we have to
hold her down.
Her.
Yeah, it was pretty brutal.
She's been like that since she was very, very young. But given the low risk for unvaccinated kids, should we actually just take the pressure off them and leave them unvaccinated until they feel more comfortable?
Look, a lot of kids are afraid of needles, and there's a lot of different strategies that you can use to vaccinate kids who do have a needle phobia. So I'd encourage you to consider a few different strategies first before you decide not to vaccinate at all. And those things might be things like going to a GP where instead of a hub where you might be able to talk to a nurse, lying down during the vaccine and having some time afterwards to lie down, some distraction techniques and things like that. So you might be able to watch an iPad or something like that while you get the needle. All of those things are good approaches that work for a lot of people with a needle phobia. If your child has a really, really severe needle phobia and you do still want to get them vaccinated, you can go to a specialist immunization clinic at a children's hospital. So in Victoria, we have the Royal Children's Hospital, and they have all kinds of different strategies that they can use for kids with severe needle phobias. If you're sort of weighing this up and you're thinking about the needle phobia and also the risks of COVID, look, I do want to reassure parents that COVID is generally mild in kids. And so it is something where if your child can't be vaccinated for whatever reason, as long as all the adults around them are vaccinated and most people around them are vaccinated, that's probably the best protection that we can give them other than being vaccinated themselves. But I do think, as more people are vaccinated and we are moving around more, it'd be a great idea to consider vaccinating your kids as well.
Dr. Jessica Kaufman from the Murdoch Children's Research Institute, this has been a really, really delightful and I think important conversation. I hope that it helps a lot of parents who are wondering about vaccines for their kids for COVID-19. Do you have any final comments?
I think my final comment would just be that it's really normal to have questions and to have some concerns about the vaccines. And I want to encourage parents to think this through carefully, talk to your GP, talk to, other people in your lives, but, weigh up the risks and benefits. And ultimately, I think with COVID, it's a matter of when we get exposed to COVID rather than if. And I think that should factor into your decisions.
Lovely to talk with you, Jess.
Thanks, Jess. Great conversation. Really appreciate it.
No worries. Thanks a lot.
Well, thanks so much, Dr. Jessica Kaufman from the Murdoch Children's Research Institute. Important conversation, and we hope that this has been a helpful podcast for every mum and dad listening. The Happy Families podcast is produced by Justin Rulon from Bridge Media. Craig Bruce is our executive producer. We love it when you leave ratings and reviews for the podcast so that other people can find out about it. Please open up your Apple Podcasts app. Just click on our podcast, leave a rating and review. It takes like 15 to 30 seconds, and it's done. It helps other people to find out how they can make their families happier. If you'd like more info, by the way, about making your family happier, you can do it by visiting happyfamilies.com.au.